Welcome back to the channel. Today's topic will be gestational diabetes. Now, many may feel like once pregnant, you could eat anything you want, right? Because you're technically eating for two. But you still have to be careful and watch what you eat and try to pick healthy options because this is a disease that can occur with any pregnancy. So in this video, I will cover all the things you need to know and how to prevent it and also manage it. So hit the like button if you're as excited as this cute little baby right here. Gestational diabetes is diabetes that is diagnosed for the first time during pregnancy. In the United States, it occurs in up to 10% of pregnancies, but we are still not sure what causes this. If you look it up, most sources will list it as unknown, but others have stated that it's because during pregnancy, hormones like estrogen, cortisol, lactogen increase, which reduces the effect of insulin, leading to insulin resistance, affecting the uptake of glucose into cells, so increased blood glucose. But although any woman can develop gestational diabetes during pregnancy, some of the factors that may increase their risk are obese women because they may have much higher of the levels of those hormones that increase in pregnancy, family history of diabetes, having given birth previously to an infant weighing greater than 9 pounds, women who are pre-diabetic, and lastly, being older than 25. So based on these risk factors, we can screen certain patients. So pregnant women with no diabetes risk factors, we screen them during the time it's most common, which is during the third trimester. For patients with diabetes risk factors, we screen them earlier, so at their first prenatal visit. These patients will do an oral glucose tolerance test, so they will get 75 grams of oral glucose, then wait 1 hour. Then after 1 hour, if it's over 180 milligrams per deciliter, then gestational diabetes will be diagnosed. Please keep in mind that the cutoff numbers for diagnosis may vary with guidelines and laboratory device utilized. So now that we know the patient has gestational diabetes, we can begin management. Goals of therapy is simple: prevent complications to the mother and the baby, and also maintain blood glucose level below the recommended values using non-pharmacologic and pharmacologic options, as this will impact the possibility of complications for the mother or baby. Hypertension alone or preeclampsia, which is hypertension plus signs of damage to another organ. The baby may be diagnosed with macrosomia, which means the baby weighs more than 8 pounds at birth. Babies may also present with hypoglycemia and respiratory distress syndrome. To prevent these complications, we want to begin management right away. We like to start with non-pharmacologic options like exercising and staying active, and also maintaining a healthy diet. And the pharmacologic options come into play when the non-pharmacologic options are not working. So insulin. Now, insulin is the traditional first choice drug for blood sugar control during pregnancy because it is the most effective and it doesn't cross the placenta. The use of oral medications for managing gestational diabetes are controversial. Now, the long-term outcomes associated with metformin are still uncertain, and some recent studies have suggested that glyburide may cross the placenta, so we have to weigh the risk and benefits. But regardless of which treatment option we choose, we must continue to monitor the blood glucose levels. And that will be the end of this video. If it was helpful, make sure to like, subscribe, leave a comment, and also follow me on Instagram at Pharmacist Academy. Thank you for watching this video and take care.